Good day, Austin. Today is HIV Vaccine Awareness Day. It's a day to highlight the need for a vaccine to prevent HIV infection and AIDS. It also recognizes the thousands of volunteers, community members, health professionals, supporters, and scientists who are working to find a safe and effective AIDS vaccine. Joining us this morning to talk more about this is Dr. Sandra Guerra, Chief Medical Officer for Texas Health Action and Kind Clinic. Good morning, Doctor. Thanks for joining us.
Good morning. Thank you for having me.
Yeah, absolutely. So let's talk a little bit more about the vaccine. Where exactly are we in terms of being able to have a vaccine to prevent HIV?
Well, over the years, there have been a lot of close opportunities where we unfortunately have not gotten to the point where we have a vaccine in the way you and I would think about it. But the reality is we do have a way to prevent HIV infection, and that is with a pill. It is called PrEP, and it is something that a lot of people all over the world are eligible for and can get access to taking a pill a day to prevent the infection of HIV.
Tell us a little bit more about what HIV really is.
HIV is a virus that is spread in a couple of different ways, but primarily through a blood-blood contact. It is a virus that then comes into a body and then sometimes lays dormant for a period of time. So that means that people do not know that they are infected until eventually it replicates within the body and unfortunately attacks our immune system, which prevents us from being able to protect ourselves against a host of other infections that could be in our bodies.
You talked about a pill to be able to prevent this. When would be appropriate to take it, and how if we have a pill, what would be the benefits of a vaccine?
Yeah, so the pill is something that is taken every day, and it is a great option that is available to people today. It has very few side effects, and it is covered by most health insurance. So we are very much encouraging people to get that access to that pill. But as with anything else, a vaccine would be ideal. A vaccine that perhaps you only have to take once in a lifetime or a couple of times in a lifetime would be something that people then can rest assured that they and their loved ones are protected from HIV. Taking a pill every day requires an effort. You need to go and get your prescription filled. You need to get a medical visit. You need to get labs done. And so therefore that takes steps that people have to take in order to access the medication.
Yeah, what does the future of HIV treatment look like, Doctor?
I think that it's a very positive outlook, and that is because we know that hopefully a vaccine will be on the horizon at some point in the near future. We also have medications that continue to improve in the prevention of it, from oral medications to injectable medications, and then in that unfortunate time when someone does become infected, and in the United States we're having about 40,000 persons a year become infected, we know that that is still a possibility, but the treatment for HIV has become so much better over the last several years, and we continue to anticipate it will improve.
Yeah, absolutely. And again, it's important to be able to talk about this and raise awareness in communities.
Absolutely. It is important to remove stigma from persons getting tested for HIV, taking medication to prevent HIV, and also those persons who are living with HIV, enabling them to live healthy, happy, fulfilling lives with that virus that is ideally suppressed within their body.
Yeah, absolutely. Well, we appreciate your time this morning. Thank you for the work you're doing as Dr. Sandra Guerra, Chief Medical Officer for Texas Health Action and the Kind Clinic. Thanks for joining us. We'll be right back.
Thank you very much.